The health minister has drawn a firm line on volunteer work in the public health sector, saying it should not be mistaken for a guaranteed route to employment. Mr. Elijah Muchima made the remarks at a media briefing following a decision by the Resident Doctors Association of Zambia to withdraw the services of volunteer doctors beginning Monday, June 2nd. Mr. Muchima questioned the association's advocacy efforts, suggesting that some of the doctors in question may not even be members of RDAZ.
A volunteer is not a forced arrangement. Yes, they're sympathizing with their colleagues who haven't yet been employed. We are explaining that because of the fiscal space, we can't employ everyone at the same time. That's your decision as an individual. I don't know how the association is coming in. Have these volunteers become their members? Do they already prescribe or what is membership? Subscribe. Yeah, that's good English. How do they subscribe to the association? Are they their members? Yet, for them to speak on their behalf. As you say, it's volunteering. It's not only doctors. We have got nurses. We've got community health workers throughout the whole country. They provide free services. And some of those like community through Global Fund. We are employing some of them. Right now we have 11,000. We have been talking to our colleagues to increase the number, at least even to 50. Because we have a lot of volunteers, and we say thank you to all those who are helping. As I said, it's about life-saving. It's about your commitment. This is a very noble career that looks at life-saving. If one feels, I can't do anything, let me just stay and wait until, it is his wish.
However, RDAZ President Dr. Pochiwe said the action is intended to send a message to government and called for a clear plan to address the concerns of volunteer doctors.
There was a mention of voluntary work is by choice, and why should we pay? We're not advocating for government to pay doctors that are volunteering, no. We're pulling out doctors out of facilities so that the gap that exists, the gap that we talk about on these tables should be felt in real time. We preach about the doctor-patient ratio, yet in these facilities it's not felt because over 50%, and in some units and departments over 90% are being manned by unemployed doctors who wake up every day, ask for money from their parents after paying their medical school and get on a bus to show up for work. Remember, the public was shocked doctors volunteer. This is to show that there is really no difference in how we provide these services. A doctor who's on payroll, a doctor who's not on payroll, we provide quality health care and with dedication to our patients. But they shouldn't be taken for granted. What we want is the impactful collaboration with the Minister of Health. We want to have a sit down and to have a clear roadmap, not the preach of there's no money. There is money.
As the deadline approaches, the impact of the withdrawal could be felt in already strained health facilities. Elfimwale Shampande, Dama News.